please welcome Samantha and give her a big round of applause.
Good morning, everyone. Thank you, Di. Very appreciative to be invited to come and speak to you today. It's something quite different. I've not spoken to an audience like this before. We typically speak to GPs, so I'm sure you'll get a lot more out of it, being nurses, than the GPs. Just to correct, I actually was a Sydney girl, and I moved to Queensland 13 years ago, and I was actually forced to move back to Sydney to get the job with MedLab. I did my PhD with Lewis Vitetta, so his name is on this presentation as well. So we worked together at MedLab. MedLab is a biotechnology company. We've started about 3 years ago. It's quite unique to a lot of companies that are already out there, like your nutraceutical companies, because we're very research-based, and we've actually got a laboratory in Sydney as well. So we've got our postdocs in there doing the research on the bacteria. We have the research team, but we've also got sales team because we do need to make nutraceuticals because that pays for the research that we do. We also do drug development, so the pipeline for us is purely drug development in the end, which does have a lot to do with the bacteria and the bacterial metabolites. So I think, in the near future we'll have some very, very interesting new therapies and new delivery systems to treat patients. So today I'm talking about the gut microbiome. I originally thought it would be quite difficult to prepare a talk that would actually be quite applicable for you in clinical practice, but once I started looking at the research and already what we were doing, it really was quite easy because there's a plethora of information out there for critical care in different conditions. So I've got a feeling I've actually got too many slides today, Di, so you'll just have to keep an eye on me. Okay, so for today, I know I was speaking to a few of you last night, and there is certainly an interest in bacteria and using probiotics in patients in critical care, and which is really, really positive. So I'm going to first talk about the gut microbiome and just introduce you to where it is, what it does, how it does, what it does, and safety issues with that. Also the gut microbiome in the critically ill, because there is quite a bit of research there as to what happens within the gut. Bacterial influence on the host, how it actually functions with producing its positive effects in the body, because I think there's a bit of confusion as to how they're actually working. Also, I'll go through a lot of the research is currently available, a lot of Cochrane reviews, there's quite a few of those out now, and other systematic and meta-analysis looking at different conditions in ICU. And then I'll sort of finish off with the ideal protocol, because people are actually starting to propose how we can actually put this into clinical practice within the hospitals. While it is there a little bit, there's a long way to go with that. So the gastrointestinal bacteria, from traditional opinion of humans being in control and we are the most important things on earth, that bacteria are basically pathogens that we need to kill. There's no therapeutic effect, and they do not play any role in the health of our bodies, because we control that, of course. We do now know that this is completely untrue. We remember from biology at high school, even university days, you've got your cells, you've got your tissues, you've got your system, your organs, and then your organ systems. And we thought, this is how we treat the body. But all this time, we've actually ignored the most important organ within the body, and that's the gut microbiome. So the gut bacteria itself is an organ within our body and functions quite significantly. So with the human microbiota, you've got 10 to the 13, 10 to the 14 bacterial cells on and in the body. What this means is 90% of us is bacteria, so only 10% is eukaryotic cells. The total composition of the genes from the bacterial cells is about 9 billion. When you compare this to our own genetic coding genes, the bacteria is about 150-fold more genes than the human genome. So when you get an idea of how our genetics work, how they function metabolically, when you think of the bacteria having 150 times more potential than we do, then you start to realise how important they are in relation to health and disease. Okay, so with the bacteria, as you descend down the gastrointestinal tract, it's the density and diversity increases significantly. So within the upper small intestine, you have some facultative anaerobes. So your lactobacilli, streptococci. This is basically where these type of bacteria reside. But as you descend further into the large bowel, this is where it's all happening. This is a huge amount of bacterial population. So you've got about 10 to the 14 bacterial cells per gram in the gut here. And this is really important because the gut bacteria, they teach us the language, well, they teach the host the language of molecular biology. They teach how the immune system develops. They teach how the gastrointestinal system develops. Without the bacteria, this just doesn't happen. And they show this in germ-free mice. So within the immune system that is, surrounding the gut, it's not consistent right through the gastrointestinal tract. And, you have dendritic cells are quite different in different sections of the gut. So it depends where the bacteria is and the density as to how the immune system is functioning there, which is really important when you're considering how to treat, inflammatory conditions or autoimmune conditions as well. With the bacteria, I think there's a bit of confusion as to where the bacteria are within the gut. And I still read it in publications today where they say the bacteria all adhere to the epithelial cells in the intestine. And this simply isn't true. The bacteria do not adhere to the cells in the gut. Our actual gut, and especially within the large bowel, it simply couldn't handle the assault of the amount of cells from the bacteria. So within the small intestine, you have a small layer of mucus lining. And the bacteria here, the commensal bacteria, as you can see up here, so you've got your mucus here, they sort of adhere into the mucus, and they're basically in the lumen as well, so they're just here. There's probably one that we know of at the moment, segmentus filamentous bacteria, which does adhere, but all other bacteria doesn't actually touch the cells. So when you go into the large bowel, in the colon here, you've got two layers of mucus. It's a lot thicker. So you've got your inner layer and your outer layer. So most of the bacteria actually sit in the outer layer of this mucus. So the mucus is a very protective barrier to the bacteria, even the good bacteria, your commensal bacteria, from touching the cells. So then I'll talk a bit later as to if these bacteria aren't actually touching the cells, how are they functioning in instructing the body? You think they'd be touching the receptors. I mean, there are receptors there for the bacteria, but it's not the bacteria that are touching it. With the bacteria in particular, I'll talk about the gut microbiome today because this is the most dense and diverse section of bacteria on the body, with the skin probably the second most dense and diverse. The bacteria, the gut bacteria, this is one of our publications. We've done a lot of publications. This is where Di found Lewis and myself. Recent one we did last year was end organ function. So we looked at all the research of the gastrointestinal microbiome on end organ homeostasis. So you can see from this diagram here, the gut bacteria actually influence all end organs, particularly the brain. Is very much associated with mood, so depression, anxiety. You've got your liver. We do research with NAFLD and probiotics, so we've got some very good animal data at the moment. Your lungs, your muscle, your kidneys. We're doing research in chronic kidney disease at the moment. Your immune system, very, very much associated here. And adipocytes. So with this, we are actually got 2 research programs going at the moment with diabetes and pre-diabetes and looking at gut bacteria and probiotics. So with the bacteria, they affect all end organs. They affect the mucosal barrier, the tight junctions in the barrier, intestinal maturation. They stimulate mucus secretion, secretory IgA. Without the bacteria, this does not get secreted. They metabolize everything that we ingest. So the drugs, alcohol, and herbal medicines, nutraceutical medicines, they're all metabolized by the gut bacteria, which is really interesting. When people give herbal medicine, they really don't know what the active is because it's actually a metabolite of the bacteria, not that compound in the herb. And as I said, mood. So there's a lot of research with gut bacteria affecting mood and depression. So a brief history of probiotics, how they actually, started to come about, and the interest of them was Mechnikov. So it all started, in the 1900s, where he associated pathogenic bacteria in the gut with aging, and the good bacteria, lactic acid bacteria, with longevity. And he noticed this in the Bulgarian peasants. He then published the Prolongation of Life, where he did associate the good bacteria on metabolizing food and actually, being responsible for our health. So he actually won a Nobel Prize for his work on immunity and the gut bacteria. So it started about the 1900s, the interest in probiotics and their actual effect on the body. So the definition of a probiotic, which you may be aware of, is that they're live organisms. So when they're administrative, they produce health effects on the body, and they've also got to be able to pass the gut, the stomach acid, and get to the places where they need to be. Prebiotics are your fibres which actually stimulate the growth of the good bacteria within the gut, particularly your bifidobacteria. And then these are responsible for things like your short-chain fatty acids, so other metabolites that have a function within the body. And then you've got your symbiotics, where there's quite a few on the market now where they've actually combined probiotics with the prebiotic at the same time. And when I'm referring to the microbiome refers to the gut bacterial genetics, so the bacteria and their genetic makeup as well. Also, there is a lot of confusion when people are referring to a bacteria. And it's through the literature, it's confused all the way through. So when you've got your bacteria, you've got your genus level. So this is where you've got your lactobacilli, bifidobacteria, streptococcus, saccharomyces, which are typical probiotics on the market. Then you go down to your species level. So it's a species where you're looking at your acidophilus, your casei, your bifidobacterium infantis, animalis. And it's the strain level, which is like your Rhamnosus GG. So it's all those little numbers at the end, those unusual references, which is the strain level. So you may look at publications where they refer to being